Hello, my name is Simron Singh. I'm a medical oncologist at the Sunnybrook Odette Cancer Center at the University of Toronto. What trial do we have for first-line therapy for new patients who are newly diagnosed? Well, as we know, octreotide and lanreotide, these are the two agents of somatostatin analogs that have been the mainstay of treatment for neuroendocrine cancers. Somatostatin analogs work by binding to these special receptors that are found on neuroendocrine cancers called the SSTR receptors. And there's five of them. And these two drugs, octreotide and lanreotide, generally bind to standard receptor 2. We know from two previous trials, the PROMID trial and the CLARINET trial, that the somatostatin analogs work. They slow the progression of the tumor down, and they're fairly effective in almost all neuroendocrine cancers to not only slow disease progression, but they also reduce hormone secretion. The NETTER-1 trial, which looked at PRRT after patients had progressed on 30 milligrams of octreotide, in fact showed that those patients who got 60 milligrams of octreotide, which was the control arm in this trial, had a 9-month PFS. That makes some people think that perhaps there's some benefit to what we would call high dose octreotide or escalated dose somatostatin analogs. This was also shown, albeit not in a randomized fashion, in the CLARINET Forte trial, which in fact showed patients who had progressed on lanreotide standard dose to get a higher dose of every 2 weeks. And in some patients, not all, but in some patients, there certainly appeared to be some benefit at prolonging the growth of the cancer before it actually grew. And that was generally in patients who had a lower grade neuroendocrine cancers. So when we think about how we're going to treat our patients, a number of factors come into place. First and foremost is we want to make sure we're using evidence-based medicine, and we want to share decision-making with our patients. From a patient point of view, we want to do whatever we can to ensure that the injection experience is as positive as possible, and that the patients have autonomy and shared decision-making. We understand in today's environment with constrained healthcare resources, we want to make sure that we use our resources and we use the way we treat patients to ensure that we get the best outcome with the best quality. And somatostatin analogs generally meet all these tick boxes. So the question on the SORENTO trial is, does long-acting octreotide above the standard dose or exposure lead to an increased progression-free survival compared to our standard treatment right now, which is standard dose octreotide and lanreotide? This uses a new technology called the fluid crystal drug delivery system. The fluid crystal technology basically is a small lipid compound that is released into the skin, absorbs water, and then slowly releases drug at a higher concentration and a higher period, potentially giving a more high exposure of the tumor to a higher level of drug. The SORENTO trial tests a specific compound called CAM2029, which is a ready-to-use fluid crystal technology. It uses a rapid onset and a long-acting octreotide release, and potentially this has a lot more exposure of the tumor to octreotide than standard dose. The syringe is much smaller than the traditional syringes we use, and it comes in a pre-filled pen. So the goal would be that with room temperature storage, this might be easier for patients to use for self-administration, and in fact can potentially improve the injection experience as well as efficacy. This just simply shows some preclinical models of pharmacokinetics of the amount of exposure the tumor cells may have to the drug. And you can see here that potentially they could have 10 times the amount of increased exposure of the tumor to the drug with this new compound. So the SORENTO trial is the largest trial to date of somatostatin analogs. It's a randomized multicenter open-labeled phase 3 trial looking the efficacy and safety of Octreotide Subcutaneous Depot, which is CAM2029, versus standard treatment, which could either be octreotide LAR or lanreotide LAR in gastroenteropancreatic neuroendocrine tumors. The trial is a randomized trial of 302 patients. Patients are randomized to receive either CAM2029, 20 milligrams every 2 weeks, or the standard dose of octreotide LAR. Upon progression of octreotide or lanreotide, the standard doses, there is crossover. So again, this allows all patients to have access to the new treatment with CAM2029. CAM02029, the new agent, is a 20 milligram dose. It's a small needle, so a subcutaneous injection in the abdomen, the thigh, or the buttock. It can be administered by the patient or the patient's partner after training, and after month 2, so after 3 doses, the patient is able to administer it himself. The standard arm is what we're doing now, generally in clinical practice, which would be either octreotide or lanreotide every 4 weeks, generally given by a trained healthcare professional.